Just as Chris Murphy said today, we're going to frame the day with discussing the implementation of the Bipartisan Safer Communities Act. And as Michael led the day, really important that it was bipartisan. And before we jump in to the Bipartisan Safer Communities Act, we're going to introduce each other. So we're going to start, and if you can also speak to what personally has brought you to this effort around gun violence prevention. Jim, we'll start with you.
I love your hesitancy of like, oh Lord, we're going to start. I feel like a little fish out of water somewhat because I'm a politician from Texas talking about gun violence reduction. Oh my word. I'm a strange bird. I'm probably one of the strangest damn mayors y'all will ever hear of. I'm a former Marine. I'm a former police officer. I have a license to carry a gun. I am an attorney. I've been involved in shootings. I know what it's like to be a part of gun violence. And that's why I'm blessed to be invited to come here and share my story and talk about the importance of taking small bites out of that apple, little ones at a time. I live in a state that thinks, and when I first ran for mayor, what I heard from one of my opponents, there was 9 of us running, Lord, who wants to be mayor, but 9 of us running, and one guy said, well, I know the solution to fixing gun violence in schools. And they said, what's that? We're on a debate. And he says, you post a sign on the front of the school that says, every one of our teachers are armed and prepared to defend our children. And I looked over at him, I said, you're out of your blanking mind. What is wrong with people? But the good news is we're making progress little bit by little bit in Texas. And I'm excited to be here and give a little bit different perspective of where we're at.
And Jim, I think that this represents the cross-sector that we're looking to discuss in this room and certainly the different perspectives. So thank you.
Thank you.
Amy.
Yes, thanks. Good morning, and thank you so much to Northwell for hosting this impressive convening. My name is Amy Solomon. I am the Assistant Attorney General at the Office of Justice Programs at the Department of Justice. Personally, I've been in and out of this work from government, philanthropy, and think tanks for 30 plus years. But I just want to talk for a second about institutionally where I sit. So the Office of Justice Programs is the largest grant-making organization in the Department of Justice. We focus our federal grants, which are in the order of $4 to $5 billion a year, federal grants, technical assistance, research, and data on advancing community safety, building community trust, and strengthening the community's role as co-producer of public safety. And this conversation is very much in our sweet spot. We work across the board from prevention to reentry, but we are very uber committed to reducing gun violence and have some roles in implementing the Bipartisan Safer Communities Act. And I look forward to discussing that later today.
And that grant work is so vital to everybody in this room, and it's certainly the healthcare sector as well. Rob, thank you for being here. You can introduce yourself and something personal about the work.
Yeah, no, good morning. Thank you to Northwell and to Michael for convening this important group. I think the thing that I know that's personal is how heartbreaking this work is because of who you've lost, because of who you've helped, who you've treated, but also the hope of what we can live with tomorrow. And I now sit in the White House, go into the West Wing every morning at 9:10 to talk about what we are doing about this issue every single day from a public health perspective. But 21 years before that, soon after my cousin was shot and killed, I remember a very different time. I remember a time when, and I can see the article in my head as I sit here now, in the Washington Post, the gun lobby said, with the election of George W. Bush, we'll work out of the West Wing. And I can tell you how far we've come from that day, as instead of them, we have gun violence survivors like me and Greg Jackson actually working in the West Wing of the White House. I can tell you how far we've come because We didn't have more Democratic votes in the Senate in 2022 than we did in 2013. It was still just 50. But instead of 4 Republican votes, we had 15. That is bipartisan progress and momentum because of the work of rooms like this, because of the heartbreak that we pour into the hope, because the pain of our past we pour into the present for a safer future. And so I am proud to be here and to share this story and to share the work that this president's doing, because he has taken more executive action than any administration in history. He has signed the first gun safety law in 30 years, and he created this office to do the work of gun violence prevention. So thank you so much for having me, Northwell, and can't wait to jump in.
And I think highlighting the Bipartisan Safer Communities Act is extremely important. You heard Chris Murphy say it. Progress has been made, and the groundswell of work in this room is what creates the progress. So let's start with some initial questions in general. Rob, let's go back to you. Can you speak to some of the most critical initiatives out of the White House now on gun violence prevention?
Yeah, I'd be happy to. So when the president set up this office, I can tell you it was a little overwhelming. I didn't even know this thing was going to exist until I got a call and was asked to serve this country. And he made it easy, though. He gave us 4 key tasks that guide the daily work. He said, 1, we see FEMA respond when there's a hurricane or a natural disaster. We need a coordinated federal response for when there is mass violence, when there are concentrations of community violence. So Greg Jackson, my fellow deputy director, leads a 6-agency effort with a lot of help from Department of Justice and Victim Services to actually provide help to the individuals and the communities who suffer from violence, making resources more available, bringing things to the table. The second thing he said was build a better state and local partnership. So we have the largest convening in this administration's history with state legislators from 39 states talking about a safer states agenda that had a host of solutions: investment, survivor supports, infrastructure, as well as gun safety laws. And then he said, I need you to think of new executive actions. And we've put about 80 ideas in play across 16 agencies, everything from funding to data to enforcing the law against rogue members of the gun industry. And lastly, he said, I need you to implement the Bipartisan Safer Communities Act. And so with our incredible partners at the agencies, we've been really focusing on the progress we've made, but also what's there left to do to make sure that the promise of that law turns into policy change that saves lives.
Yeah, and you say partnerships, and again, that's what's here in this room, are the partnerships, and I think that is how we make progress. Amy, maybe you can speak to some updates on some recent efforts from your office in collaboration with other agencies or work in this room.
Yes, sure. So one important piece of the Bipartisan Safer Communities Act, we call it BISCA. I don't know what you call it in this room, but that's our shorthand. One part is the community violence intervention work. So thanks to BISCA, $50 million a year for 5 years supports community violence intervention. We've also, the last 2 years, had $50 million from appropriations. So over the last 2 years, we've invested $200 million in community violence intervention and prevention issues. This is the largest federal investment directly into this effort that we've seen, and it is so exciting to help build the community infrastructure in concert with public safety and public health to make for stronger communities. So far there have been 76 sites funded in 29 states. We're also funding using micro grants to fund smaller community-based organizations to help both with resources and technical assistance make them stronger. We're funding evaluations so we can continue to build the evidence about what works. We're funding technical assistance both for grantees, but also for jurisdictions and organizations that want to be involved that haven't before. So there's a new website that was just stood up on the LISC website. I can provide those resources. And I want to say and give a shout out to my colleague in the room over there, Eddie Bocanegra. Our starting place here was bringing on board someone who had led one of the most successful and rigorously evaluated community violence interventions in the field, Eddie Bocanegra, who led Ready Chicago. And he has been at the table with us. He's leading really how we design this effort at Justice and in concert with our partners at the White House and across government so that it can be designed in a way to really reach the communities that are hardest hit and need this help the most.
And I think it's fascinating, the micro grants and then the macro grants, right? Because if we don't get to the micro grants and the community-based organizations, that's where the connections need to be made for sure.
Yeah.
Jim, can you speak of something that's urgent for you or critical for you in the gun prevention area?
It doesn't get more urgent or critical than a minute ago, I get a text message from my police chief that one of our high schools is on lockdown because a kid brought a gun to school. That's something as a mayor you worry about on a daily basis. Arlington is the entertainment capital throughout the Southwest United States. We have 7 professional sports franchises. We have the world's largest esports stadium. We have Six Flags Over Texas. Yes, I would be remiss if I didn't acknowledge the fact that we are home to the World Series champion Texas Rangers. And my constituents would kill me if I didn't rub that into the Yankee fans up here in New York every once in a while. So we have everything from Taylor Swift concerts to WWE to everything. And as mayor, I am constantly worried about when that next shoe is going to drop. Thank God that it didn't drop today. They were able to get the gun and get the child and get things under control. But that's the urgency I have as mayor, is constantly being concerned about when the next critical incident is going to happen, and is it going to happen in my community?
Yeah, and certainly we talk about our children and protecting them, and there's nothing more critical, but you just got a text. We have trauma surgeons in the room. We deal with this every single day, and that's what we have to effect. So since we are really talking about collaborations and partnerships, let's talk about the healthcare sector. Public health crisis, gun violence, health of our communities. How can we be supportive partners? How can we partner together? What are you seeing in your work? Maybe Amy, I'll start with you.
Yeah, thank you. And I will just quote back Michael talking about going outside his lane. I'm so thrilled that he and Northwell have called all the healthcare sector together to go outside your lane, or to not see this as outside your lane. The health-based violence intervention programs, HVIPs, I'm sure we'll hear more about them today. They're such a critical part of the community violence intervention work. As we understand it, there are about 40 HVIPs right now in action. These are community-based victims advocates. I'm sure we have some in the room who could describe this better than me, but who are on the scene in hospitals when people who have been injured need that kind of help the most, and not just the medical help, but the connection to services, to address trauma, to connect people and their families into services and interventions so that the cycle does not repeat themselves. We know that these hospital-based interventions are critical, and actually no one better than Greg Jackson can speak about this so powerfully. We know that there's a great need, and we know that they can work both in preventing re-victimization and also preventing arrests and convictions for violent crimes. They're so important, and there's so much work we need to do to scale them up. We are supporting hospital-based interventions and technical assistance through the HAVI, through these CVI grants, but the scale of, with 50,000 ER visits for firearm injuries, with 6,000 or so hospitals, we've got 40 hospital-based violence intervention programs. There's so much need to scale quality programs. And I think what's important here for the health executives in the room is partnering with the community-based organizations who have this expertise, who have credibility in their communities, who have victims' expertise, so that they can be the partners that come into your institutions to help provide the help when it's needed the most.
And we always talk about the ability to scale.
Yeah.
And that's always one of the most challenging things, I think. But the partnerships, I think, does take that to a new level. Rob, in terms of healthcare collaborations, what are you seeing?
I think it is so significant to have this partnership. I think what we know in this room is that gun violence is one of the quickest ways to become a disabled American. And to deal with that, we need that ecosystem that's thinking about this public health epidemic on all the angles, right? It's not just what's the one solution, but what's the suite of solutions to address the problem in community. And so that ecosystem of a federal effort with a state effort, a local effort that a health system is such a vital part of is essential. But I have 3 ideas that are pretty concrete, though. I think one is data.
Yeah.
I think we just need better information on where gun violence is happening, and we have to layer on top of that, where are we making investments into HVIPs, into survivor supports, into community-based interventions. Because without that information of where there's violence and where there's investment, we can't make smart decisions and then measure the efficacy of those decisions. The second is secure storage. I think it is so important to think about responsible gun ownership. And I say that as someone who grew up with guns, who certainly respects the right to own a firearm, but also how important it is to take that step to make sure it's stored responsibly. And we have to give people options to meet them where they are. Maybe it's a cable lock if you have a toddler, but if you have a teen, more than likely it's a safe, a biometric safe or a locking safe. But we have to make people aware of why secure storage is important. We have to make devices accessible, and we have to hold people accountable. And the hospitals and health systems, I think, can play a major role in the awareness and the accessibility around secure storage. And I have to also double tap the hospital violence intervention programs. That is an essential piece of this puzzle as well when it comes to not just intervening before there's retaliation, but getting people the survivor resources that they deserve under the law, which is another thing that the Department of Justice is working on, which is easing the restrictions around who is eligible for victims' compensation. So I think the health systems are one of the most significant partners in addressing this issue.
I agree, and we have an initiative at Northwell led by Chetan Satya, who is here, who we ask our patients in the emergency rooms if there are guns in the house and are they safely locked up. And when we talk about scale, those are the things that need to be scaled, but I think the partnership is critical. Jim, healthcare collaborations that you think about, put into action where we can
You know,
do that?
y'all are blessed, and you're blessed from the standpoint of healthcare professions are one of the most trusted professions on the face of the earth. When we're sick, we go to the doctor, and the doctor tells us what we need to do to get better. I'm a lawyer and a politician. That is, I'm batting 0 right now when it comes to a trusted profession. But we do things better when we do it together, and that's what we say in Arlington all the time. Having the voice of Northwell and all of you different healthcare professionals adds tremendous credibility to what President Biden is trying to do, to what our senators and our congressmen and women are trying to do, to what our local officials are trying to do. Where otherwise people would sometimes turn a deaf ear to what's being said, when y'all speak, it matters. So that's why this type of forum is so critically important, is because you bring with you this inherent sense of trust where people are going, well, damn, the doctor said it should be like this, so it's gonna be like this. And that's important, so thank you.
Yeah, and certainly in terms of staying outside or going outside our lanes, it doesn't seem outside our lane anymore.
It's not outside y'all's lane.
In terms of the implementation of the Bipartisan Safer Communities Act, let's talk about the communities. Where are we seeing it unfold in the communities specifically? The monies out of the initiatives, the cross-sector work? Rob?
Yeah, so I think what this office has done is focused on all forms of gun violence, and we've developed strategies around not just the shootings that we've all seen, but the ones that are unseen. The suicide that happened behind closed doors, the intimate partner violence, where we know a gun in the hand of an abuser makes it 5 times more likely there'll be a homicide. The community violence that happens every single day that I grew up with in Brooklyn and have seen finally the investment of resources and prioritization, and the schools that our kids go to. And so for each of those, we are developing, with the president's leadership, real comprehensive strategies, because it can't just be the Office of Justice Programs that's thinking about public safety. It has to be the Department of Labor, who just has recently pivoted their grants to make sure that communities that suffer from violence get prioritization in pulling down funds for summer youth employment, which we know the evidence shows can reduce community violence. It's not just the Department of Labor, it's the Department of Education, who is one of the most trusted voices in talking to principals. And so the US Secretary of Education just sent a letter to every single principal in this country encouraging them to have conversations about secure gun storage with their communities. Those are principles that you can work with. Help them feel confident having those conversations. But it's not just the Department of Education, it's also HUD, which we know is putting money into our urban centers, and they're focused on how they're supporting community violence and how they can talk about secure storage. So I can go down the list, but that is the biggest difference that I'm seeing, is we are working across government finally at the federal level, but that same energy has to be at the state level, it has to be at the local level, and health systems, your convening power, your leadership, your proximity to this pain makes you, I think, some of the most important partners in that ecosystem. So to me, we are investing with strategies and intention where the gun violence is happening. We are focusing on where the illegal guns come from with the first gun trafficking law in history. We've prosecuted 300 cases, taken over 1,000 guns off the street. The most robust regulation of gun dealers. We have a data-driven prioritization of who we're inspecting. And I can tell you we've increased revocations of rogue gun dealer licenses by 10 times since 2021. And we've gone right at one of the fastest growing threats, ghost guns, which are parts that you could make at home and they end up in the hands of kids. You could build it in your bedroom. And the truth is, we're not just talking about the kid who might have it. We're talking about the companies who make market profit from them. Right? That's who needs to be held accountable and brought into this conversation. And I think health systems can help us have that conversation with a public health lens. When you're talking about how we're marketing these products, how we're designing these products, how the industry is profiting, it is a very important voice just to pull back the cover and say, is this right? Well, shouldn't we be more responsible when we talk about storage, when we talk about the time and space between someone in crisis and a firearm? Can't we have those conversations as well as make sure that we are investing? And so that is how we have taken these new tools and focused them directly on where the violence is happening so that we make sure, as Amy was saying, that the communities that are doing the best work are also being lifted up and getting the resources they need.
I mean, your line, the proximity to pain is certainly in the healthcare organizations, but it's really for all of us. Amy, in the communities, if you can touch on the mental health elements where healthcare and other agencies work together and where the Bipartisan Act has had an effect there.
Yeah, thank you. One of the other provisions of the Bipartisan Safer Communities Act is something called Burn State Crisis Intervention Programs. Burn SCIP is our shorthand there. And this was $150 million a year to support states to develop implementation for extreme risk protection orders and for other crisis intervention programs, mental health courts, treatment courts, crisis intervention in the community, deflection. So this is a wonderful tool. The states were required to do this kind of cross-sectional work. So to access most of the dollars, they needed to put together state crisis intervention boards that were made up of representatives from across different sectors in their states to put together a plan and a budget. And I know there's a little push-pull because it's taken a while for some of these dollars to go out, but it's because this part of the process, putting together these boards and plans, it takes some time. But I am convinced that this was an investment that's going to be, it was necessary, but it's going to be so worthwhile and serve states and localities over the long haul as they address gun violence prevention. So just to give one example, in Ohio, I know that the hospitals and the healthcare sector are in a big way at the table with the criminal justice representative and actors, and they are focusing their resource in Ohio on behavioral health deflection and crisis intervention in communities across the state. And that is being well informed by the healthcare sector, and those dollars are being informed by the healthcare sector, and so it's very exciting to see. I'll just add that we are putting technical assistance in place to help make states as successful as possible. So the National State Criminal Justice Agency, we have a courts partner who are helping, and also the Johns Hopkins Gun Violence Solutions group, who is running and going to be lifting up a national ERPO center in the coming weeks. They're already doing incredible work, I know you all know, across the country, and have great expertise on extreme risk protection orders, but they'll be putting up a website and offering some proactive technical assistance to states and jurisdictions who want to take advantage.
Yeah, absolutely. Thank you. Early intervention, these crisis interventions, preventing the events. That's so much of what we see. Let's end on optimism. Michael led us with optimism. The positive change, incremental, it's a long journey. Jim, where do you see the optimism? What are you optimistic about? What change are you seeing that you'd like to end with here?
I'm seeing the tide shift a little bit in my very red state, where there's a lot of folks that believe the answer to gun violence is to put more guns on the streets. And it's starting to turn. It's starting to turn because we have influence coming from above the state at our federal level with President Biden and his efforts. We have push coming from the local level with the big city mayors of the state of Texas going up. And we have people like y'all who are speaking out about the importance of addressing the real issues that are out there. Gun violence doesn't give a damn if you're a Republican or a Democrat or black or white or old or Latino or gay or straight. Gun violence kills. Period. It maims, period. It will put you in disability forever. We have to get beyond party politics. And this country has been divided for far too long on party politics. We see it everywhere we go now, where people, the hate that we used to see as much in cultural differences or ethnic differences are now in political party differences. And folks, that doesn't make any sense. We can do so much when we band together and we say, listen, we're all within arm's reach of each other belief-wise. Let's work together on this thing. So I'm starting to see the tide shift in Texas. We want to get to where other states are at with things. But remember, as that tide shifts, those extremists who have a tendency to get in control, they will do what? They will do crazy shit. They just will. Can I say shit? I'm sorry. They will do crazy shit. And we have to keep the fight going and not let extremists, which regardless of political belief, run our states and our country into the ground.
Thank you. I just want two more, Amy, and then Rob, something optimistic from your area.
I'm optimistic seeing at the community, at the state and the federal level, just an ecosystem growing that is so committed and informed to address gun violence reduction. And I will say I'm also optimistic. The urgency couldn't be more real. And I think that having the Bipartisan Safer Communities Act move and be implemented and have support across the aisle gives me hope about the more that we need to do to meet the moment and the urgency.
Thank you. Rob, from the White House.
Yeah, look, we're optimistic because every day we get to come to work and focus on the solutions for this pressing issue. And I think we've never had that before. We've never had this close to the President of the United States and the Vice President, people working directly and solely on gun violence prevention. That makes me optimistic that all of us can accelerate our work, we can expand our work, we can lift our work, we can do better with our work, because we have a president and a vice president who've said this is the challenge of our time. This is the priority in our communities, in our schools, in our homes. And that makes me optimistic, is that they let me in the building tomorrow, and the day after that, and the day after that. And as long as they will, I can guarantee you that me, Greg, Amy, and the rest of the people on this team are going to be dedicated to solving this issue.
We agree.